Ignorance is bliss. We've heard that phrase many times. Ignorance is bliss in chaos, maybe not so much. So I remember not that long ago, my grandmother collapsed in the kitchen. And the emergency department, the EMS team came and they said, "Where do you want your grandmother to go?" And I immediately said Forsyth Medical Center, because I knew that there was quality and safety. But at the time, I wasn't the clinical health equity officer. And I didn't know then what I know now. I didn't have to think to myself, I wonder if they'll treat her differently because she's 4'11". I wonder if they'll treat her differently because she's an African American or because she's a woman. Will they give her the same care because she's over the age of 80? Ignorance in the moment was bliss. What I know now is that across the country, women get care different, especially in cardiac care. In some places, if you're older, the first thing they'll say is, well, she's already lived a good life, before they even do the first EKG. I'm working with a group of physicians now to understand unconscious bias. The pretest scores were 0% to 80%. The good news is that we were doing a test. The bad news is there was actually a physician that had no understanding that unconscious bias, what you bring to the table every day when you come in and you take care of a patient, could potentially impact the outcome of the patient. The quality of the care, the safety. Those were the questions we were asking in the pretest. Fast forward in the post-test, the worst score was 80%. The best score was 100. The good news is we're learning. The bad news is we had to go from 0% to 80%. In the middle of my kitchen with my grandmother literally in my arms, if I had known that there was a physician that scored 80% and then a physician that scored 0%, it may not have been as easy for me to answer the question about where I would. Maybe we should have sent her to Kernersville. I don't know, because we haven't tested Kernersville yet. But what I know is that the work that we are doing today with physicians and nurses to better understand themselves and their perspective and the framework that they have and how that impacts whether or not the woman on the ground that I care about will live or die, they need to understand that. And then I realized that it's not just them, because that powerful 4'11" woman on the ground taught me some unconscious bias too. See, I remember I was growing up, you didn't have to sit in the car seat. That's how long ago it was. And so I'd be bouncing and about in the back of the car, and the car would always break down because we couldn't afford a good car. And my grandmother would hop out because she was one of the two women that raised me, and she would push that car. She's 4'11", so by the time she really pushed the car, her head would drop down behind the trunk level. And we would joke and say, when her head got down there, you'd know that that car was going to move. So my unconscious bias as a physician was, if you were a 4'11" woman, you wore a cape. You were a superhero. So as a physician, when I walked in the room taking care of patients who were senior in age and petite, you should just get out of the bed and make it happen. Because that's what 4'11" women do. It's not just about race and ethnicity, it's about what we grow up with. All of us have the ability to take unconscious bias to the bedside and change outcomes in ways that, frankly, I don't feel that comfortable. I want every patient that we take care of to have the same outcome, regardless of their dimensions of diversity. That's going to cost us. It's going to cost us time. We need physicians to understand that that's really important and that they're going to have to sit down the same way I did and look at a module and understand what their framework is and what that framework does to the outcomes of our patients. The module doesn't come free, but is an investment not just in developing our professional selves. It is an investment in making sure that the quality of the care that we give and the safety that we give and the connection that we have is something that every single time our patients can count on. That, in my mind, is remarkable. It's the tagline. We need to change it from a tagline to the core of who we really are. We want to be sure that that is what we give every day. We talk about human experience all the time, so we've been charting human experience scores. And there are lots of efforts across the system looking at human experience. But we ask 4 specific questions. One of them, the leading question, is how does your doctor communicate with you? So when leaders round and we're asking questions, or you're sitting in rehab and you're finding out about the person next to you and their experience, that's all a part of our work in human experience. But then at the doctor level, that means we did something to change the experience that our patients had with their physician. So by illuminating the fact that there's unconscious bias, helping people understand how they need to shift their framework, our patients have experienced us as physicians in a very different way. They don't even know that the quality changed and the safety changed. As leaders, you do. All the patients know is that when they walked out the door, they experienced something that they would want to experience again. We'll keep it our secret that we change quality and safety. And that's why it's really important that we do the work to gather our physicians and our nursing colleagues, our advanced practitioner colleagues, and start working towards understanding unconscious bias and making sure that we understand what health equity even is. Making sure that every patient, regardless of the dimensions of diversity, get exactly the care they're supposed to have. It is the patient's right, it's what they expect of us, and it's something that we have to do. This is not optional. Watch it 3 times and still forgot.